I'm Dr. Jayakar Thomas, Professor and Head of Department of Dermatology at Sri Balaji Medical College, Chennai. I will be talking today on one of the very common disorders that we get to see in dermatology practice, namely urticaria, and also touch on its management. Allergic diseases are very common amongst the general population. Amongst these, urticaria, and specifically chronic urticaria, is likely to affect up to 20% of the population during lifetime. Often associated pruritic wheal and flare reaction, which may be associated angioedema, can also cause pain for some patients. Factors triggering the onset of urticaria can be identified only in some patients, but the disease is idiopathic in about 50 to 80% of all cases. Through this understanding, our best option to manage this condition is to avoid identifiable triggers wherever possible, but mainly to counter the allergic pathophysiology of urticaria using antihistaminics. While all international guidelines recommend the use of second-generation antihistamine as the first line of treatment for urticaria, it is difficult to select the ideal one, as the commonly prescribed ones lack efficacy, for which we need to add or updose current available antihistaminics according to the patient's profile. Today I will be talking on this molecule, namely belastin, with particular reference to updosing of an antihistaminic. Now, the commonly used antihistaminics will have to be used with caution when we want to increase the dosage. For example, when we use cetirizine or levocetirizine, we will have to updose it with a lot of caution, and which will have to be done only at the night doses. It cannot be done during the day doses because the sedative effect is going to be very high. When we look at a non-sedative second-generation antihistamine like fexofenadine, again, in updosing or increasing the dose of fexofenadine might show to be deleterious to the cardiac. Therefore, the cardiac musculature has to be looked after. So there is, at one extreme, medications that can be used by night but can cause high amount of sedation, and at the other extreme that can be used by day but can have high degree of side effect profile, which is not seen with belastin even in up to 4 times the dosage. That is 20 milligrams the normal dose, you can go up to 80 milligrams. Now, belastin is considered as the first choice of antihistaminics among the Asia Pacific physicians. Also, the allergic rhinitis impact of asthma recommends belastin as the highest scoring antihistaminic amongst all second generation antihistaminics, and it is the only one to achieve a perfect 10 in the antihistaminic scorecard. Now, belastin comes as 20 milligrams tablet, once daily dosage, which is effective in the managing symptoms of urticaria, and when we consider its comparative effect, it acts much quicker than cetirizine and acts longer than fexofenadine. Belastin's effect versus levocetirizine are backed by studies which state its superiority in percentage of symptom-free patients, response rates, and health-related quality of life. Second-generation H1 antihistamines are ineffective in completely relieving symptoms in 30% of patients because histamine may reach very high concentrations in the skin due to its poor diffusibility in the dermis. In these patients, the World Allergy Organization as well as the European Academy for Allergy and Clinical Immunology recommend increasing the dosage up to 4-fold. High dosage belastin, 40 milligrams to 80 milligrams, has demonstrated efficacy in the treatment of urticaria with an effect superior to cetirizine, rupatadine, and desloratadine. Even in patients not responding to antihistamines, study by Wheeler et al. Found the initial treatment with belastin, 20 milligrams for 2 weeks, resulted in a significant 37% reduction in the urticaria activity score. Updosing to 40 milligrams in patients who did not respond to 20 milligrams provided a further significant 23% reduction in the urticaria activity score. A post-hoc analysis of the 10 worst affected patients in this study, who showed urticaria activity score of about 18, showed the mean urticaria activity score to fall 25% on increasing belastin from 40 milligrams to 80 milligrams, showing benefit in these severely affected patients. As a clinician, therefore, I will certainly look forward to using antihistamine, mainly because it checks most of the boxes for the qualities needed for updosing an antihistamine. Belastin has been acknowledged for use by guidelines such as the Allergic Rhinitis Induced Asthma Society as the only one to achieve a perfect 10 in the antihistaminic scorecard, and has also been scrutinized to become the first choice antihistamine among Asian Pacific physicians.